Sorry for looking like shit. I cut my own hair. I cut my own hair a couple of days ago, and my friend told me that I look like the Da Vinci brothers.
Da Vinci?
Hello, everybody. My name is Oliver, and today I'm going to be talking to y'all about atrophy of the downstairs parts. And the first thing that I want to say is a little bit of a warning, which is that I have a tendency of using more like clinical medical language because I find it more concise for communicating. I know that a lot of people can be made to feel dysphoric by certain words, certain terminologies, and I empathize with that. For me personally, the thing that makes me dysphoric when talking about medical stuff is actually like the cis normativity rather than the body parts themselves, because it's like, yes, it is a vagine, but that does not mean it is the body part of a woman, you know? So it's like, it's not a big deal to me. It's just a body part that can belong to anybody. So I just wanted to put a warning out there before we begin that I might be saying words that might make some people feel dysphoric. So you have been warned. So today we're going to be talking about vaginal atrophy. There are two populations mainly that experience this condition. The first one being post or menopausal people, anybody who's going through menopause or is post-menopause. The second population that experiences this most commonly is people like me, transmasculine people, people who are assigned female at birth and start hormone replacement therapy, who are on testosterone. In my opinion, the most important thing that I wish everybody knew about atrophy is that it's not some weird thing that only trans people experience. Like, there's a lot of transphobic people who want everybody to believe that transition is super dangerous and that its effects are, you know, something that only trans people go through and it's like deadly and disgusting. No, the atrophy that trans guys experience is almost identical to the atrophy that menopausal people experience. So it's always been really frustrating to me to hear people scaremonger about this, and so that's actually one of the big reasons I decided to make this channel, because I want to fight the disinformation and promote actual accessible information. So I decided that in making this YouTube channel, one of the first things I want to do is talk about my own experience with atrophy and like the early signs of it, how it progressed, and what I'm doing now to treat it. It's actually pretty easy to treat, and it's not dangerous. It is just as dangerous as going through menopause. Today's video is going to have a little bit less of a focus on the educational side and more of a focus on like the personable side. I'm just going to be sharing my experience, like my going through atrophy, and then what I decided to do about it. I'm not going to talk about every treatment option for atrophy, but I'm going to mention two that I tried and one that I think is one of the better options for transmasculine people. So I started testosterone about a year and 3 months ago, and I started off on a low dose of the I think it was the generic Testo gel, which you rub into your arm every day, just one pump of it. And within 6 months, definitely within 6 months, I started noticing that I wasn't having discharge anymore. I still was having periods on that low of a dose, but no discharge. And it was really nice, really cool actually, because I never liked having that stuff. It was always like really like dysphoria inducing for me. But within that 6 months, whenever the discharge stopped, I was not experiencing any kind of negative effects, like any kind of like dryness or itchiness or pain or anything like that. Also, whenever it came to like penetrative intimacy, I didn't have any problems like self-lubricating. There were no problems on that end whatsoever. So after I was on this low dose of testosterone for about 7 months, I lost my health insurance and I had to switch to injections. And by that time, I was actually starting to get pretty impatient with a lot of the changes happening so slowly on such a low dose. And so I was finally ready to be on a about an average dose of testosterone. So, changes started happening a lot faster. And after that injection, I stopped having periods. I did not have another period after. And I slowly started noticing more dryness, a little bit of itchiness, and by the 12-month mark, I was experiencing a little bit of discomfort. Something that I want to mention at this point is that I've actually been using the wrong word. So most people call this condition that I've been describing vaginal atrophy, but it was actually determined about 8 years ago by like a council of gynecologists that vaginal atrophy is not medically accurate nor sufficient to describe this condition. And so what it is now called is Genitourinary Syndrome of Menopause, or GSM. And this is really important because a lot of people, they hear the words vaginal atrophy and they think, oh, it only affects the vagine, but that's not true. One of the most detrimental effects it has is that it can affect the urinary tract. Not only does it make the vagina more vulnerable to infection by raising the pH into a level where it's not supposed to be, and also it can cause a lot of bacteria that are supposed to be in there, good bacteria, to die, and so it becomes very, very vulnerable to a lot of infections. But the same thing happens to the urinary tract. And so when I was a little over a year on testosterone, I started experiencing some itchiness, and also it wasn't smelling the best down there at some point. So I went to the gynecologist, and by the way, it wasn't terribly dysphoria-inducing to go there, and she did not look at my parts. I did not take my pants off in front of anybody, and she actually left a Q-tip in the room essentially and told me how to take a swab of myself. And I also peed in a cup, and she later contacted me letting me know that I had a UTI, which was kind of obvious because every time I peed it burned really bad. And it would kind of be like I would wake up in the morning and I'd feel okay, and then I'd go pee, and then everything would hurt, and I would feel a lot of burning inside of my vagina after I went pee, because and what my doctor told me is that it was probably because the vagine is so delicate that almost anything would make it burn and sting, almost anything that it would come into contact with. So you go pee, and then your pee touches the insides of your vagine a little tiny bit, and then your vagine's like, ow, I'm going to burn for the rest of the day. That's what was happening to me. And that wasn't a way that I wanted to live my life. I had to go take a course of antibiotics, fucking horse pills, for a few days, and then it turns out that those were the wrong antibiotics, so I had to go back to the pharmacy and get more antibiotics and take those for a week. And one of the risks with GSM is that if a doctor is unaware of this being a problem, then they'll just see, oh, you have a UTI, and they'll keep prescribing antibiotics instead of treating the root of the issue, which is the lack of estrogen. Whenever you are on testosterone, it causes this part of your body, the genitourinary system, to not have enough estrogen to take care of itself, basically. So if you have GSM and you leave it untreated, then that predisposes you to getting UTIs over and over, and it also just predisposes you to getting vaginal infections of almost any kind over and over. And not only that, but being put on antibiotics over and over for UTIs and other infections puts you at risk for antibiotic resistance. That's not a good thing. That's not a thing that anybody wants. Yeah, and if the other option is to just, I guess, leave the UTI untreated, which is, then it travels to the kidneys. And then if it does that, then you're in real big trouble, and you're definitely going to have to be on antibiotics. Let me just say that when I was 18, I got a UTI, and I did not treat it fast enough, and it traveled to my kidney, and I got a kidney infection, and it hurt really bad. You do not want a kidney infection. Don't fuck around with that. GSM is a progressive disease and a chronic condition, so it gets worse over time, and it can't treat itself. It won't get better without some kind of intervention. And one of the most effective interventions for GSM is by treating the root cause of it instead of trying to treat symptoms like dryness and things like that with lubrication, which can help. Vaginal moisturizers can help a little bit, but it doesn't fix the problem. It doesn't treat the condition. So what I decided to do, because I don't want to be on antibiotics all the time, and because I don't want it to burn when I pee all the time, and I don't want stinky vagine that hurts. I want happy, healthy vagine that feel good. And so what I decided would be the best course of action for me would be to add an estrogen. And actually, when I first started experiencing a bit of dryness around the 8 or so month mark of being on testosterone, I asked my doctor for an estrogen cream, which it can be a pretty good option. But if you are a transmasculine person who's relatively young, then you're going to have to be treating this condition for decades, probably, if you're going to be on testosterone for many, many years. And a problem with using an estrogen cream is that it increases your risk for endometrial cancer. And I didn't want to increase that risk. So I did some research, and I learned that an estrogen will increase your risk of endometrial cancer if it is unopposed by a progestin. So the logic there is you can have estrogen and progestin to cancel out that increased risk. This is Premarin conjugated estrogen cream, which is the first thing that I was put on that I didn't end up using a whole lot of, and there are a couple of reasons for it. For one, I was a little bit scared of the gosh dang cancer, and the other reason is because the first time I used it, I used the amount that it told me to use, which was an ungodly amount that you have to put in like a syringe and then put it in there, and like it was a very unpleasant process. Let me just put it at that. Since then, I did talk to the gynecologist, and she said that using like a pea-sized amount, like putting it on your finger and then putting it in there, like twice a week should be sufficient. But I had pretty severe side effects whenever I used this for the first time because I used such a large amount. And basically what happened was I woke up the next morning with some spotting, and I also woke up with one of the worst migraines I've had in my whole life, and I was in the worst of moods. So if you use Premarin, like I said, just use a tiny amount. And pro-life tip, you can usually, if you live in the United States with the shit healthcare system and lack of Medicare for all and all that, you can get this stuff for not $200, but about $15 if you go on their website and look for a coupon. You like have to sign up and like have it emailed to you. It's kind of weird. But yeah, my little sister works at a pharmacy and she teaches me all of the things. So if you do happen to get an estrogen only cream or a topical only estrogen medication, I would use it for a short amount of time as necessary because it does increase your risk of endometrial cancer substantially. But the medication that I have decided on that has been working really well for me, oh no, it's my address and my name. But the medication that has been working really well for me is the off-brand of NuvaRing, Illuring. So I was prescribed this ring about 2 months ago. I'm about to put in my third ring in 2 days from now. And that sentence structure makes it sound like I'm just putting more in. I'm gonna take it. I'm gonna take the second one out and put in the third one, okay? And you can see the ingredients on here are etinogestrel and ethinyl estradiol. And the really cool stuff about this thing is, besides eliminating the cancer risk, is that I don't have to worry about messing around and putting stuff inside of me like more than once a week. It's not messy. It's just like a little plastic ring. It looks a lot like a ponytail that you would put in your hair. And once a month, every 4 weeks, I take out the old one and put in a new one, and that's all I have to do. And ever since I've been on this, I've had no issues with UTI. I've had no issues with dryness or burning or itching or anything like that. Reasons why I recommend using this ring, getting a prescription for this ring instead of the cream, besides the cancer risk, is that it has a significantly higher, the ring has a significantly higher rate of people actually following through with treatment because it's much more convenient and it's not messy or gross or anything. And for me personally, it's had very minimal side effects as well. I didn't have anything like a migraine or spotting. And of course, like, your mileage may vary. I can't tell you that this is going to work out for you. I was really scared to start this because I was like, oh my god, what if I have too much estrogen? What if it starts making me have my periods again? Oh my god, oh my god. And like, there's a chance that it could happen. But for me, this has been really good shit. I have memory issues and ADHD issues and motivation issues. So something that I can just put in every 4 weeks and then not think about it for another 4 weeks has been perfect. I was looking at studies kind of comparing different treatments for GSM, especially like topical estrogen treatments, and people don't follow through with using this stuff very well. So you can try it if it's like your only option, but I personally don't think it's a good one. Also, you won't feel this ring inside of you. You're not gonna know it's there, really. You might be like, oh no, is it gonna fall out? No, it's not gonna fall out. If you have a partner and you do penetrative stuff, they might notice it. There's a chance they could notice it and feel it, but my partner does not feel it. The other thing, here's a bonus. I mean, in my opinion, this is a real big bonus. So, this stuff is also a birth control. Yeah, this one is not a birth control. But, I mean, I was considering getting an IUD before I realized that this would be an option for me. It does everything I need. Literally everything. A lot of trans dudes worry a lot about putting estrogens in their bodies, and I understand the concern. One thing that is very unfortunate about being trans is that there's a little bit of a lack of information. A lot of there's a lot of studies to be done to figure out if things will interfere with our transitions or not. Because, for example, it is unclear if estrogen interferes with hormonal transition for trans men or not. But the good thing about choosing a local estrogen, a topical estrogen, is that it's not going to increase your serum levels, the amount of estrogen inside of your blood, like generally in your system. It's not going to increase that as much as like a birth control pill would. It's not going to increase it very much. But there is still a chance that you might experience things like depression, even though you're not taking a pill. This is something that can potentially affect your mood, affect your appetite. And personally, I think I've been even more hungry. I think I've been eating a lot more since I've been on this stuff. So if weight gain is a deal breaker, you might want to read about that. One of the side effects that caught me off guard that lasted until about 2 weeks ago is cramping. I had a feeling in my lower abdomen that felt a lot like a menstrual cramp, and I had that almost constantly, like 24/7 for about a month and a half, which is a long time to have that discomfort. It was not very severe though. It was pretty easy for me to ignore, which is kind of saying a lot actually, because I'm a very sensitive little baby when it comes to any kind of pain or discomfort or anything my body is doing. And it was one of those where, like, if I was aroused or if I had late orgasm, then it would be worse sometimes. So it's a little bit strange, but it seems to be one of those side effects that, at least for me, went away over time. Another one that's been a little bit unpleasant for me personally is I'm having the discharge again, which really kind of blows, because I did enjoy the side effect. I enjoyed testosterone making there not to be any of that stuff, but it kind of makes sense that the reason why the discharge stopped was because of GSM, because I didn't have enough estrogen. And so, I mean, not having discharge is kind of just a precursor, kind of like a sign that you're experiencing GSM. But for me personally though, it's definitely worth it to actually maintain my health and maintain this part of my body that I don't plan on getting rid of. Even if I gain a little bit of weight, even if I have to deal with goopies in the underpants, which is I really don't like. This has been really good for me. Also, there's actually one more side effect. A lot of birth controls, again, like this, can have a side effect of depression. And I don't know exactly how common it is. I'm actually disabled by PTSD and depression, so depression is something that I've been dealing with for a really long time, and it's kind of like just a thing that I'm always fighting. So I'm a little bit more predisposed to it, as well as it's really hard for me to tell if this prescription actually triggered a depressive episode, or if it was just time for another one. My girlfriend did just lose her job about a month ago, and so I've been under a lot of stress. We don't know about money and stuff, so it's very possible that I might not have gone through this really bad depressive episode because of this ring. I might have gone through it because of external stressors, or I also might have gone through it because I actually had my testosterone dose reduced slightly not too long ago, which can result in less energy and mood changes and things. So it's a little bit difficult to say, but the point is this thing works. Estrogen works. GSM is caused by a lack of estrogen, hypoestrogenism, and adding estrogen to those body parts is the most reliable way to treat it. I was running out of space on my SD card, so let's wrap this up. Okay, so things I want you to walk away with after watching this video. First one, I'd say one of the most important ones, is that atrophy is actually only one part of a broader condition called Genitourinary Syndrome of Menopause. It's really important to know that, because now you've got this terminology that you can use to do more research. You won't be searching for atrophy and only getting this one very specific part of the condition. You'll be getting the whole thing and getting all the information you actually need. The next one is, it's all caused by a lack of estrogen, and it can be anybody. It doesn't have to be trans people. It's anybody with these specific organs, these body parts, who aren't getting enough estrogen to take care of them. There are other treatment methods that can help manage the symptoms of GSM, but generally speaking, they won't be as effective or as reliable at treating GSM. They won't be treating the root cause. They'll just be, helping you feel a little better in the meantime. So although I understand the hesitance, you're gonna want to use some kind of estrogen, and probably for a long time. Other thing to know, if you find some kind of a prescription estrogen, you don't want estrogen to be unopposed because it will raise your risk of endometrial cancer. The next thing, I guess, is just I highly recommend using one of these rings, because you just fucking put it in once every 4 weeks and it's handy dandy, I must say. Thank y'all for watching this video. I hope it was helpful. If it was, maybe consider subscribing. Maybe leave a comment if you want me to go over some more topics, because there's a lot that I want to talk about.